Hey, this is Dean with Sciatica Relief Now, and I am on a Zoom call with Michelle over in Australia, giving her a free consult. Michelle has been dealing with low back issues for the last 5 years. In 2013, she developed left-sided buttock and leg pain. She had a discectomy and a laminectomy in 2014, and just this year, in February, her right side started flaring up. She's been pretty active on my Facebook group, talking about how her sciatic nerve has been sitting on her lamina, and the doctor is suggesting possible surgery to try to take that lamina out in order to relieve that nerve pain. I started this morning with her, and she is a trooper because right now it is 11:51 p.m. over in Australia, and she agreed to do a free consult with me. She had a buttock pain of 5 to 6 out of 10, and a leg pain and sciatica pain of 4 to 5 out of 10 running down the leg. We just did some things to her good side, her left leg, did some trunk rotations, and I want to turn it over to Michelle, who I am grateful has said, yes, please record this, and I can use it for our website and other things. So Michelle, tell me, first of all, thank you for agreeing to do this. But number one, tell me how you felt before this call.
In pain-wise, well, apart from being nervous and everything, pain-wise, I was 4 or 5 in the right buttock and right leg.
Now, is that about your normal amount of pain that you've been having for the past 4 or 5 months?
Yes, it comes and goes. Sometimes it goes to a 6, and it might go down to a 4, depending what I'm doing, depending how much I'm walking during the day. Also depends whether if I'm doing nothing and just staying in bed, sometimes the pain can feel tighter. So,
now you were a little skeptical to do this with me, weren't you?
First time for everything, I'm always nervous.
Okay. And were you expecting any type of relief, any type of help, or was it more you were just looking to try to figure out what to do?
I've read a lot about what you're doing and your advice on other people, and I saw your webinar, and everything you described that other people describe about their pain, I could relate to everything. You know, I got a little bit teary in areas because I can understand how a lot of people are feeling. I'm grateful now after my operation in 2014. Prior to that, I was paralyzed. After the operation, I walked immediately, pain-free and without aid. I've had a few issues over the 4 years, but the worst issue I'm having is now. But I'm grateful also that the pain I'm having now is not as severe as what I used to have. Therefore, when I talk to some people on the group, I can relate to what they're going to and try to help and give advice as much as I can. And the exercises that you gave me this evening, wow, I feel a lot more flexible. The pain is always in my buttock because that sciatic nerve is sitting on that bone. It's not going to pain disappear completely, but I feel refreshed. It is it's amazing. And the exercises that I did it on the opposite side of where the pain is. So I'm grateful for Dean for his time and thankful for your advice and exercises, which I will definitely keep up, as well as my walking every day when I can. There are some days where I feel tight and can't walk. But again, Dean, thank you very much. Yeah, I feel good.
Good. And so your pain that was in your buttocks, which was about a 5 to 6, I thought you said when we started, and you stood up just before, after we did the exercises, and I think the word was, spelled forward and backwards, it still spells wow, what you said. I can understand that Australian language. You said wow, and I said, what's wow? And you said the pain in my buttocks.
Oh, okay.
But the pain in my buttocks is maybe a 1 to a 1.5. And it hadn't felt like that in how long, did you tell me?
Since the beginning of this year, when I had the severe pain, I did a little bit of gardening and pulled too many weeds. And I think as I pulled too many weeds, I've irritated something in the spine, caused the issues now. And yeah, so from back then, you know, I wasn't walking earlier on this year, but now I am, and now I'm sitting here. I'm still leaning on my good leg, but I can sit. I'm here sitting with you, where normally I'd be laying down, leaning on my hand, you know, taking the weight off the bad side. So yeah, it's good to be able to sit here. Hopefully
Awesome.
I can drive again. Driving has been a literally, no pun here, but driving's a pain in the butt.
Yes.
So before I go driving, I'll try your exercises, do a bit of that stretching, and see if the magic continues to work.
Awesome. I like it. The magic. Well, these are just beginning exercises. And like I do with most people on consults, I try to give them enough to be able to go, okay, I can control the incredible amount of pain. There's always more that can be done, but I just want to say thanks for taking this time. Thanks for being willing to come on screen at almost midnight in Australia. And I look forward to hearing reports in the group about how you're doing. And I will be posting this in the group because I know you started a nice long conversation with a bunch of people. So I'm going to be putting this video on there so that they can see what happens when people actually take me up on the free consult. So I appreciate it, and I hope you have a wonderful night and get some rest.
Thank you very much, Dean. And again, I appreciate your time and your advice, and I'll keep you posted on the wall on how I'm going.
All right.
Thank you again.
All right. Bye-bye.
You too. Okay, bye.